Alright, here's a quick little thing about mixing IRM. We're going to take our powder and liquid that we have, and take our scoop, get a nice unpacked scoop, and put it right in the center of yours. I like having a little extra powder off to the side just in case I need to change the consistency. I'm going to recap that, make sure it's nice and tight so it doesn't spill over. Get your liquid. Usually the liquid to powder ratio is 1 drop of liquid to 1 scoop of powder. So here's my 1 full drop of liquid. I'm going to have a little bit extra to the side in case I need to change the consistency later. I also have a little bit of water for firming up my mixture, for firming up my IRM mix if I need that. I'm going to add my powder into it in increments, small increments, getting that mixed real nice. Depending on what type of consistency that you want, if you want more of a paste to be able to put into like a crown or a temporary crown to cement it for a temporary amount of time, then you can just add a little bit of the powder, like half or a little less, depending on what consistency you want it. If you wanted it to go to more of a base and you wanted to use it as a sedative base to thermally insulate the tooth from the filling, you might want it into a firmer capacity. You have a couple methods of mixing. You can either do it in a little figure-8 motion, like a butterfly, or you can do a stropping effect or a stropping motion where you push down hard on the material and really mix in that powder to the mixture real well. And depending on what type of mixture you want, you may be able to take this and mold it into whatever form you want. A lot of times if you're going to be just, say, placing a small little base, you may want to make it into a small little hot dog. Get your condenser and grab a piece and give that off to your doctor so they can place it. If this is ZOE and we were using it for, say, the canals of a pulpotomy, then you may form it in this manner, maybe even a little thinner, so that they can easily just place it directly down into the canals the best that they can. Of course, if we wanted to use it as a full temporary replacement for a class 1 or a class 2 filling in the posterior, just having this in a little ball form in the correct size that we'd want it would be perfect. Now, IRM takes a little bit of time to be able to set up, so I'm going to be putting a drop of water into it. You don't need a full drop, but mixing a little bit of water into your IRM mix will help it firm up a lot quicker than it would on its own. Just doing a little bit of mix into there, getting it nice and getting it to absorb that liquid a little bit. That'll reduce your setting time for your IRM drastically, so that we can so it can be nice and firm right when we go and right by the time the patient leaves the office. Now, sometimes when you get to these and they become really sticky, you want to guard your instrument with powder so that when you're placing your temporary, it doesn't just stick to the instrument the whole time and get pulled out, because it really sticks easy. So in that case, using your condenser or whatever instrument you like, dip or stomp your instrument to the powder, making a little guarded layer where I can still grab it, but when I go and place it, it goes off real easy. And that's what's useful for having a little extra powder for being able to play around and do stuff like that. But as we go in, make sure you have the right consistency. Practice a little bit, get that down on your timing on when you need your IRM to be ready. Adding a little bit of water starts this process of being able to firm up, and starting to get to that point right now, which is good. And make sure that you pack your either your cavity prep or fill your temporary crown well enough with the right consistency so that it can hold and stay in place. And right now it's pretty much almost firmed up all the way, and it just starts breaking apart now. Instead of it being a moldable Play-Doh, it's more starting to break apart from itself, and it doesn't stay in its right form when I put stress on it.